Hello everyone. Well, today we are talking about a randomized clinical trial comparing two kinds of stented device used to treat carotid stenosis. The aim was to compare, of course, as I said, the efficacy of both the traditional one, that is the closed cell stent, with the new one, the Casper stent. They were, of course, implemented during the angioplasty stenting. So the traditional one, this one, as are you seen, is like a more huge space. They're more larger, and the new device is like, as you saying, like have a more closed cells. Okay, so the aim of the study was to compare both, like to achieving if one could be superior to another one in preventing strokes. So it was used a randomized prospective open label trial with blinded outcome in a multicentric superiority trial. Okay, and here we are okay, of course, for this study, because in neurosurgery we think that are not a lot of this kind of the study performed like this way. Here are the table of the criteria of inclusion. The patients were blinded, randomized into two groups. The Casper group, that is the new treatment group, and the traditional, that is the closed cell stent with the ratio of 1:1 using a virtual flip coin web-based site. Okay, and here we are okay. Of course, they explained for us how they did the randomized process to choose the patients. For the primary endpoint, they used the consideration of new ischemic brain signs on the MRI between the first 6 hours and 24 hours after the procedure. And for the secondary endpoints, they consider like the occurrence of strokes, of transient ischemic attack, they're also called TIA, the amaurosis, symptomatic miocardial infarction, and also another ways of disease that could be lead to death, or death related to the procedures during the first 24 hours after the treatment, and also for the next 3 months of follow-up. The sample size were previous literature based. They used a calculation of 100 subjects proportion of 45% in the closed cell, that is the traditional one, or the control group, 50% in the Casper group. Adjusting the sample size calculate for the proportion with a limited sample size or 100 subjects, it would be necessary with 90% of power and 0.5 of significance for alpha, 49 subjects considering 15% of proportion in Casper group, and 34 subjects considering 45 subjects in cell group. So the study used 47 patients in the control group and 41 in the new treatment group, the Casper group. Here maybe so we have some problem, but our calculate found that 34 subjects for 50% of proportions, with 100 subjects, like we said, considering that 90% of power and an alpha of 0.5. The study used 31 patients. Maybe here, I don't know, they used like 18% more than the necessary. Our calculate, we found that 49 subjects in control group were necessary, considering a proportion of the 45% with the same power of 90% and an alpha of 0.5. The study considered that 47 patients were necessary to this. So here, if we consider a loss of 20% of patients, we could have like 42 patients. So here I consider that this analysis was okay. Maybe they use it like the 18% to balance the group. I don't know. So the continuous variables they presented here as means, considering the mean and the range like standard deviation or the median, and they use the student test or the mean Whitney test for this calculate if they are parametric or not parametrical. Find this, and they use it appropriately as I think. So, but the authors don't clearly explain what were like the continuous variables. I mean, maybe the duration or the length of the procedure, we don't know. Maybe here, I think it's just the one they would consider. Here they don't found statistical significance for anything. There were no difference nor for the primary nor for the secondary outcomes. So for stroke in the MRI and for TA or myocardial infarction or ipsilateral stroke. The statistical analysis, for me, the tests were properly chosen. For continuous or for the categorical variables, okay, here I found that they were properly chosen. The sample size, they use they increase like 80% of sample size in one group, in the treatment group, maybe like considering to balance the loss of these patients in control group. I mean, I don't know, but maybe yes. Instead of the negative results, so of this trial, the no superiority of the new treatment is useful, I think, because it compares like two devices that they use it for the same purpose, but they have different technologies, and if we consider this new technology, we know they could cost a lot for public health. So okay, I think here we have such a good trial. Thank you so much for you guys. I'll put above the link of this trial so you could check everything as I did. And I think that for the young neurosurgeons and also for the most experienced one, this is one good trial that we have to have on mind, like to perform such good trials and like to try to calculate and explain everything. Okay, so thank you for you to listen me today. Have a wonderful day, and check after here this great paper. Okay, bye bye, see you guys.